I'll be talking briefly about the trade and services chapter and some of the impacts it has on public and essential services. So we can go to the first slide, please. The service rules in Chapter 8, what does it do? So it effectively aims to open up services to international investment and reduce government regulation. I guess one of the big issues with this is that it's effectively opening up some sectors to further privatisation or to be privatised, and it's really avoiding any kind of re-regulation of industries by governments. It's enforced by the state-to-state dispute process. So as Pat said earlier, there's no ISDS, which is good, but there can still be state-to-state disputes. The intention is for public services not to be excluded, but there is a definition of public services in there that is quite ambiguous. It states them as being services provided in the exercise of government authority, not on a commercial basis, nor in competition with other service providers. This is ambiguous in the context of that it's a competitive tendering process for new services. So if you look at what's happening in aged care sectors or in the emerging third sector, where public services are being effectively privatised in the community, this is only enabling this to happen further. There is no local presence required for service providers. Again, like Pat mentioned earlier, there's room then for kind of overseas companies or corporations to be able to have tax havens where they don't actually pay any tax on the service they're providing here in Australia. And I know sector did a report maybe last year, I think it was, exposing the aged care sector and how a lot of the companies providing aged care in Australia are keeping their profits offshore. Governments cannot limit numbers, location, or size of services or staffing numbers. So again, this is about basically not enabling governments to regulate industries or make changes in industries that they might be trying to improve standards in. So it's kind of a barrier to making an improvement in some areas should government choose to do that. And qualifications, licensing, and standards requirements must be objective, and they cannot be burdensome or a barrier to entry. Again, this is about trying to make sure that there's less control from the government to kind of set certain standards in place. Okay, next slide, please.
Okay.
Pat mentioned earlier, so the reservations or services not covered by the rules. So Australia has chosen a negative list for Annex 2, which means all services are covered except for those listed in the reservations. And so it's kind of like a list A and a list B. List A reserves existing regulation at current state levels and some national regulation, but it freezes the regulation at current levels, and these cannot be increased or they cannot be improved. And this is a ratchet structure they have in place. There is a list B, and these other areas of regulation which governments can increase the level of regulation in the future, and it does provide some scope for re-regulation in these areas. We can look at slide 3, which is looking at list B, please. Peter?
Which one?
The one before that, sorry. Yeah. So these are the services that are reserved and allowed increased regulation in the future. So you have law enforcement, correctional services, income security insurance, social security insurance, social welfare, public education and public training, regulation of admissions, accreditation and funding of public and private education services, health, childcare, public utilities, public transport and public housing. Again, looking at what are some of the bigger areas that might not be covered in there. Aged care pops out again, and we'll talk about that in the next slide. So yes, what does it mean for the services that aren't reserved? So we're looking for aged care, for example, which isn't expressly reserved in there. If you're looking at kind of some of the recommendations that came out of the Royal Commission, and these look at things such as increasing staffing, having more qualified staff, and increasing things of care, these would be limited by the RCEP rules. This is concerning for a number of reasons. I guess one is the fact that there are continuous campaigns by unions and continuous issues within sectors such as aged care to increase ratios of staff and increase standards of care and try to increase minimum regulation of staff in the industry. And the fact that the government is now putting more barriers in place, especially when, if you look at Victoria, for example, you know, aged care was very adversely affected by COVID and exposed a number of issues. You're not even given a proper PPE. You're not having enough staff, even having staff moving between 5 or 6 different waste homes because, you know, because of the precarious nature of work there because it's so underfunded. You know, it just exposes that even further. And then alongside that, you've got the same issue of tax evasion. We've got these businesses that, you know, they're making money out of the care of people, and they're just continually they're not there to provide the service, but to get that money, and they're there to really make the most of these contracts by providing the minimum care. So, you know, the less ability the government has to regulate that, the more this is going to be a problem in the future. We've also got an issue there with environmental services. So, you know, it could have issues when you look at particularly limiting government regulation in terms of reducing carbon emissions, especially if some of these standards are seen as objective or burdensome. So it's really, again, limiting the ability to try to put some regulation or standards in place if we do want to try to regulate emissions in the future. So I guess it's like a quick summary of that all. I mean, if you're looking at what isn't worse, I mean, there is no ISDS, which is good, but again, that can be reviewed in 2 years. And there still is the possibility of state-to-state disputes. So there's still, you know, there's still could be repercussions if something is broken. There are some public services that are exempted through the negative list, but they're not all exempted. So there are areas, particularly again within the third sector, where, you know, which is open for, you know, deregulation and privatization and for these same issues to occur. And again, similar to other free trade agreements, it puts international corporations and businesses ahead of government rights to regulate industry. So it's putting kind of corporations, you know, in front of the government in terms of being able to really take control of certain areas, particularly when you're looking at public services, especially when you're talking at, you know, areas of healthcare. It's putting their rights first, and you know, it's enabling further privatization, and this really can only be detrimental to public services in the future. And that's it. Thank you.